Hi, I'm Dr. Stephen Olmos, and I want to welcome you to this week's edition of Ask Dr. Olmos. Another question is, are TMJ specialists dentists or physicians? Well, it's kind of a little bit of both. Dentists by degree, usually, in that case, there are certain osteopathic physicians. It might be some chiropractors tend to market in this way, but predominantly it is a process that the dentist would treat. And dentists have different philosophies on how they go about treating these kinds of problems. Some believe it's more tooth related. Others believe it to be more what we call psychosocial or stress related. And then there's a combination of things, because there's also respiratory reasons. People that can't breathe, their throat closes. People that have obstructive sleep apnea, basically they suffocate at night. Other people have nasal obstruction. So there's varied medical and dental collaboration. So it's basically a mix of that. As myself, we do a lot of medical, address these medical problems, but we have dental solutions for medical problems. And so it's a bit of understanding more about medicine than you would just simply practicing dentistry. And in the particular areas are how nutrition is a factor, how respiration, how to manage obstruction of breathing, how to manage and treat chronic pain issues. So philosophies interchange. There's certain philosophies that don't believe it's possible for a person to get better, and they should just get palliative treatments. In other words, treatments that make you feel better, but don't treat the actual problem. So things like Botox, different types of medicines. Obviously, opioids have been used for quite some time, and that's not been found to be successful. Finally, and so basically, the other philosophy is to do things to teeth, but I've kind of evolved to understand that respiratory problems are a great part of it. And it's about understanding what is driving this mechanism to constantly be irritated and inflamed. And then that's essentially what it is. And we all have, stress in our lives, certainly right now, more than we have in many, many years. That certainly adds to it. But there's an underlying problem there that predates and is probably just made worse by the stresses of our life. So that's what I do. I try to therapeutically rehabilitate these structures that are injured, but more importantly, finding the origin. Because if we can find the origin, then we get a cascade of relief of all these symptoms without having to manage them forever. In certain situations where people have been injured, well, yes, then there is a management component to it. But for the vast majority of people that I see with severely arthritic joints and facial pain, we're able to help them on a very consistent level by rehabilitation rather than surgery. We use a very conservative non-surgical approach with different types of therapies to accelerate healing, like a very sophisticated laser system, healing laser. And so we have a number of different varieties of lasers that we can use to speed up healing, and different injection techniques, a lot of things you can do to make things better, and then to keep them that way. As a sufferer of having been a history of having jaw joint problems, I broke my jaw about 20 years ago. I had to have my mouth wired shut. I had nasal obstruction. I have apnea. I have a history of migraines. So all of those things have been righted, and I don't suffer from those problems anymore. I manage my apnea with a device I put in my mouth so I can breathe at night, and it's amazing. My high blood pressure is gone. I don't have to be on meds for that anymore. I was hypertensive since I was 20. So these are the kinds of things I like to share with other people to demonstrate that you can feel better. And nutrition is a very big part of it, and how one of the ways that I was able to free myself from a life of pain. Thank you. Thank you.